Today we're talking about diabetes. I'm going to cover what it is, the main types, common signs and symptoms, how doctors diagnose it, glucose targets to aim for, why glucose control matters, core parts of treatment, and when to seek urgent care. But first, what is diabetes? Diabetes is a long-term metabolic condition where blood sugar, also called glucose, stays too high because the body doesn't have enough insulin or can't use insulin effectively. Over time, high glucose can harm the heart, kidneys, eyes, and nerves. There are several types of diabetes, but the main ones are type 1, type 2, and gestational diabetes. Let's look at each briefly. Type 1 diabetes happens when the pancreas stops making insulin due to an autoimmune reaction. In this type, the immune system mistakenly attacks insulin-producing cells, thinking they're harmful. As a result, the pancreas makes little or no insulin. Without insulin, glucose builds up in the blood instead of being used by cells for energy. People with type 1 diabetes need to take insulin to live. Type 1 often starts young, but it can happen at any age. It's not related to lifestyle factors like diet or weight. Type 2 diabetes is the most common type. With type 2, the body is insulin resistant, meaning cells don't respond well to insulin. Also, the pancreas may not make enough insulin. As a result, glucose builds up in the blood. Type 2 is usually linked to lifestyle factors such as physical inactivity, excess weight, and unhealthy eating habits. Many people with type 2 diabetes can manage their condition with lifestyle changes, pills, and sometimes insulin. Gestational diabetes appears during pregnancy. Pregnancy hormones can affect insulin sensitivity, leading to higher blood sugars in some pregnant people. It's important to manage GDM closely to protect the health of both the mother and the baby. Now let's talk about the signs and symptoms of diabetes. Some people, especially those with type 2 diabetes, may have few or no noticeable symptoms, which is why it's often called a silent disease. However, common signs include peeing a lot, especially at night, excessive thirst, unintended weight loss, constant hunger, and blurry vision. Other possible signs are tingling, numbness in the hands or feet, fatigue, dry skin, slow healing wounds, and frequent infections. If you have these symptoms, please get a blood sugar test. How do doctors diagnose diabetes? Doctors typically diagnose diabetes using one of the following blood tests. These cutoffs are commonly used, but they can vary a bit among healthcare providers. Often the test will be repeated to confirm the diagnosis. First is A1C, also called hemoglobin A1C or glycated hemoglobin. This test shows your average blood sugar over the past 2 to 3 months. A 1C of 6.5% or higher indicates diabetes. Next is fasting plasma glucose, or FPG. This measures your blood sugar after you haven't eaten for at least 8 hours. An FPG of 126 milligrams per deciliter or 7.0 millimoles per liter or higher means you have diabetes. Then there's the 2-hour oral glucose tolerance test, or OGTT. For this test, you drink a sugary liquid and the doctor checks your blood sugar before and after. A result of 200 milligrams per deciliter or 11.1 millimoles per liter or higher 2 hours after drinking the liquid indicates diabetes. And finally, there's random glucose. You can be diagnosed with diabetes if your blood sugar is 200 milligrams per deciliter or 11.1 millimoles per liter or higher at any time, provided you have symptoms of diabetes. What about prediabetes? That's when your blood sugar is higher than normal, but not high enough to be considered diabetes. High blood sugars, even before they meet the diabetes threshold, are a serious warning sign that you're at increased risk of developing type 2 diabetes, heart disease, and stroke. In addition to these tests, doctors might also check urine for sugar, especially when diagnosing type 1 diabetes. The presence of sugar in the urine suggests elevated blood sugar. You may be wondering, what are the reference glucose targets that I should aim for? Remember, these targets can be personalized with your clinician based on your overall health and goals. Here are targets for many non-pregnant adults. Before meals, aim for a fasting glucose of 80 to 130 milligrams per deciliter or 4.4 to 7.2 mol per liter. After 1 to 2 hours after meals, try to keep your postprandial glucose less than 180 milligrams per deciliter or 10 mol per liter. And for a 1C, aim for less than 7%. Your provider might suggest different ranges based on your specific situation. Why does glucose control matter? The tight control of glucose, along with good management of blood pressure and cholesterol, Plus, regular screening lowers the risk of complications from diabetes. Persistently high glucose raises the risk of several health problems. These include heart disease and stroke, kidney disease, eye damage, which can lead to vision loss, nerve damage, and foot problems. People with diabetes are also more prone to infections. So keeping glucose levels within the target range is essential. That leads to the question, what are the core parts of diabetes treatment? There are 3 core parts. First is lifestyle, including balanced eating, more vegetables, lean protein, and whole grains. Cut back on sugary foods and drinks. Get active regularly. Sleep well and quit smoking. Second is medications. The type and level of medicine depends on the type of diabetes and levels. For type 2, medicines can include metformin and other glucose-lowering drugs. Sometimes insulin is needed. And with type 1, insulin is essential as the body isn't making any. Third is monitoring. Check your blood sugar regularly and consider a continuous glucose monitor if it's available to you. Keep records of your results and attend routine eye, kidney, and foot checkups. Let's talk about when to seek urgent care. If you have very high sugar, extreme thirst, frequent urination, nausea, vomiting, stomach pain, fast breathing, and fruity-smelling breath, head to the emergency room right away. These could be signs of diabetic ketoacidosis. DKA happens when there isn't enough insulin in the body to use glucose for energy. As a result, the body breaks down fat and produces ketones. If left untreated, DKA can lead to a life-threatening complication called diabetic coma. If you experience shaking, intense hunger, sweating, and confusion, and your blood sugar is low, not improving after having fast-acting sugar and hasn't improved, go to the emergency room immediately. These symptoms may indicate hypoglycemia or low blood sugar. If not treated promptly, hypoglycemia can cause serious complications. Remember, managing diabetes is crucial for your well-being. Work closely with your healthcare team, make healthy choices, and don't hesitate to ask questions. We're here to help you live a full and active life despite the challenges of diabetes. And now for the easy way to remember everything. Think of a key that opens the door to your cells so glucose can enter and be used for energy. Insulin is the key. With type 1 diabetes, the key is missing. So you must supply the key or you'll die. That's why people with type 1 must take insulin. With type 2, the lock is rusty, so the key doesn't fit well. That's insulin resistance. The lock is also harder to open, so fewer keys work. That's low insulin production. To manage type 2, improve the lock through weight loss and exercise. And add medicines or insulin as needed. Thank you so much for watching. Please like and share if it was helpful. Stay well.